said before, I'm very happy to have Scott Lloyd today with us. And Scott, as an advanced public health practitioner, will reflect on his extensive, vast experience as health improvement specialist and now as a local authority research practitioner, if you want, which is an important for what he's going to talk about today. He's going to talk about a bit about the outdoor advertising and his work around this, but I think he's going to take a detour around other aspects for the School of Public Health Research and another important aspect related to the HSDRs and the scope of research within the broader local authority context. Without much further ado, I'll let Scott share his screen and then we can kick off the meeting this way.
Thank you, Marco.
So you have about 30 minutes and then we can start with the questions and answers, but I know you might have something else for us.
I don't think I'll be 30 minutes. Oh, sorry, I need to put that, I've near enough failed straight away. I was going to put that question in the chat, wasn't I? I'm just going to put a question in the chat, guys. Don't try and answer it now, just think about it, because I will ask you that question later. Right, let's get started. So thank you, Marco, for the invite. We have known each other far too long. That makes me feel old. But I'm Scott. As Marco said, I work for Middlesbrough Council and Redcombe Craven Borough Council, but I'm currently doing a doctoral fellowship here at Newcastle. So today I'm going to talk about the work that's going on to create the foundations for research in local government and what this means for you guys. I'm going to talk about fellowships and then in general and then my fellowships. And then I'm going to try and do a little bit about advice around public health messaging. So NIHR is investing lots of money into creating those foundations for research in local government. And I'm just going to go through a few of those elements. Some of you will be aware of the HCRCs, the Health Determinants Research Collaborations, and there are 30 of those across the UK, and they are there very much so to create those foundations for research in the NHS, in local government, sorry. I keep coming back to those foundations because historically we don't have them in local government. The NHS has had them for many years. I think I once found a paper where it spoke about core funding for NHS R&D from about 1961. Local government simply doesn't have that. And particularly with public health moving into local government and the increase in research that's being stimulated in social care, it's really important that we have these foundations so that we can conduct effective and safe research. Each of these 30 HCLCs, which are on that map there, they're receiving £5 million over 5 years. So that represents by itself an investment of about £150 million into research in local government. Alongside that, NIHR has commissioned the specialist centres for public health, one at Newcastle and one at Southampton. I'm going to talk about the Newcastle one. We have that investment's worth about 22 million over 5 years, and we have a whole raft of things which we do, and they're listed here. The main thing we're going to talk about today is our local authority research practitioners, which are effectively known as LARPs. And you can see the map there. That map, the orange represents where there are LARPs, and then there are big swathes of grey. But actually a lot of those grey bits, so if I look at the biggest bit that's grey on there, which would be North Yorkshire is a HCRC. Cornwall in the bottom left is a HCRC. So most of England is now covered by either a HCRC or a LARP, and then local authorities are doing, some local authorities are self-funding a research team. I guess the point is that for the academics in the room, you now have research infrastructure in local government that you can connect with. If you don't know how to connect with these people, contact me. My email's at the end, and I either know these people or I know how to connect into them. I have a database. And of course, actually, I was joking before I came on. I mean, obviously we're here on a session from the NIHR School of Public Health Research. There's also the school and all the work that they do. Alongside all that work, there's these increasing numbers of fellowships being made available to local authority staff. So in terms of fellowships, there's pre-doctoral, doctoral, postdoctoral, and there's also internships, one of which the deadline is very soon. and these are for local authority staff to engage and develop themselves as practitioner researchers, and they fund salary, research costs, PhD fees, public involvement. They fund everything. Um, these I'm not proposing to go through all these. These are the list of current doctoral fellows from a public health perspective working in local government. There's some more that have been appointed in September, and they're not listed here because it's not online yet. But you can see the breadth of topics. We've got myself looking at sponsorship. There's Amira looking at a health economics model for investment in green spaces and parks. The third one, Bryony, was looking at food insecurity and sustainability, net zero. And then there's a few around suicide prevention and smoking cessation and weight management. So moving on to my fellowships, this is a joke I made last week at a session, so I'm going to warn you, this presentation may cause you to notice bush shelter advertising more, and that's not necessarily a good thing, but that's what we're here to talk about. And I just want to give a thank you and shout out to the people who are already in my army of people who send me photos of bush shelters. If you guys see any photos of bush shelters that are particularly interesting and you think I'd like to see them, please email them through afterwards, particularly over the Christmas period. So my formal research journey, I did a pre-doc between September 21 and August 23. And then I started my doctoral fellowship last October. And my interest is very, very specific and very geeky. It is what is advertised in local authority bush shelters and what local authorities are doing to restrict that. That photo on the right, you can see in the reflection of the Big Mac. You can see me taking the photo on my bike. Yes, I have lots of photos of bush shelters. Just quickly, in terms of what's the aim of marketing. If you talk to marketeers and industry, a lot of the time they might say that marketing is very much there to build brand awareness and market share. It isn't there, despite the vast sums of money that are spent, it isn't there to increase overall sales in a market. And there's a quote there from everyone's favorite industry representative, Chris Snowden from the IEA. And they often use toilet roll as the example to demonstrate this point, and it's a fair one. No matter how much Andrex markets their products, we're probably not going to see an increase in total volume in the market of toilet roll increase. They're just after increasing their share of the market, excepting there are periods in 2009 and also 2020, for obvious reasons, the 2020, the pandemic, where toilet roll sales did go up, but they returned back to normal afterwards. The reason why sales increased in 2009 is theorized that it's because people, after the financial crash, instead of buying tissue paper, they were buying toilet roll to blow their nose. I bet you didn't think you were going to come to a talk about toilet roll. But food marketing is different. It drives increased choice of unhealthy foods and food consumption, and even brand marketing has an impact on preference, choice, and purchase and intent. That's systematic level review evidence by one of my supervisors, Emma Boyland, at the University of Liverpool. Why is it important? I think historically, most of the focus in terms of food marketing and protecting certainly young people from the impact of food marketing has focused on television and more recently online. But out-of-home advertising is said to reach 98% of the UK population every single week. And you can see that wonderful example Marco was asking me before about gambling. So that advert there was in just outside Middlesbrough Town Hall. It actually resulted in complaints to the Advertising Standards Authority, and they did actually take that advert down because it was just in bad taste. But a lot of this advertising is on local government estates, and I've got a few examples here. So roundabouts, bins, lampposts. I don't know whether that Kit Kat bench is actually on local government estate, but I just really like it. I think it's quite creative. But yeah, I mean, you could imagine it. That roundabout, sorry to pick out where it is, but that's Stockton-on-Tees, allowing Domino's to be advertised on their roundabouts. In terms of what is actually advertised out of home, Amy Finley and colleagues did a review of the global literature, and they found that across all studies, about 22% of all advertising was food, and most of that was for less healthy foods. The evidence about exposure by deprivation was heterogeneous, but there was some evidence suggesting that ethnic minority groups are exposed more. Okay, so I can't see the chat, but does anyone want to shout out which two companies do you think spend the most on outdoor advertising whilst I get a drink?
Mm.
Go on, Marco, give us a guess.
McDonald's.
And who else?
Um,
Anyone else?
KFC. That's
No.
Amanda.
maybe
Thank you,
Coca-Cola.
Amanda.
Yeah.
Hello, Amanda. Good to see you. I can't see you, but hello. Anyone else? Okay, right. I'll give you the answer. So, Marco, absolutely correct. So, the top spender on out-of-home advertising is McDonald's by a long stretch, and that's been the case for a number of years. I've got this data going back to, I think, before the pandemic. Interestingly, the number two slot was suddenly taken by this company called Alwyn Entertainment. And when this data came through, published by Outsmart, the industry trade body for outdoor advertising, I had to go back and to Google who they were. They're the new operators as of 2023 of the National Lottery and associated scratch cards and whatever. So actually, that second one is gambling, if we so deem it that way. I'll talk about gambling in the lottery later. So the data I'm about to share, it hasn't been published, which we will be looking to do. It's not been finalized. It's still undergoing checking and cleaning. It needs to be double coded, but there's a lot of double coding to be done. So if you want to use some of this data, drop me an email because okay, so where am I talking about? I'm looking at three areas, and sorry if you can't see this fully because I mean the breadth of where I'm looking is so broad. So in my pre-doc, I collected data in North Tyneside where I live, which is in the top right. In my doc, I'm collecting data in North Tyneside, Middlesbrough, and Swindon. Swindon being right down at the bottom. Takes me about 7 hours to get door to door to Swindon, but thankfully I've got somebody collecting the data there for me. So in my pre-doc, this is what I found. These are select categories. So there are 167 bus shelters with paper-based advertising, or there were anyway, in North Tyneside local authority area, representing 334 posters. Paper-based bus shelter advertising changes every fortnight. So each one of these waves is 334 photos, changing every fortnight during the summer in 2022, and then the week running up to Christmas and through to New Year. You can see that the percentages of food advertising were much higher than what Amy's review found. I think there are reasons behind that. For example, when we did some work to look at what was advertised on metro trains in Tyne and Wear, there was no food advertising at all. So if we'd have published that, I mean, the PhD students ended up leaving the country and running away with the data, so we never have. But obviously that would bring the overall percentage down. Interestingly, at Christmas there was the food dropped. I have my theories behind that, and I can come back to that later if people are interested. In terms of the healthiness of that food, so foods high in fat, salt, and sugar as per the UK nutrient profiling model. Most of it was less healthy foods, but there were certainly weeks where it was one or the other. That wave four there, for example, where it was non-HFSS food predominantly, that was because that wave of advertising, that fortnight during the summer, there was a mass campaign for both Pepsi Max and Coke Zero. I can't believe that they knew that each of them was going to be advertising, but so I don't think it was necessarily competition, but that really drove the numbers of non-HFSS food up in that wave. Alcohol tends to be low from the data we've looked at. Interestingly, at Christmas, again, 0% alcohol at Christmas 2022. Now, what I think happened there was I was looking at as I said before, the week run up to Christmas and the week after. Uh, and I suspect a lot of that, I can only guess, but I think that advertising might have gone sooner because people's purchasing for Christmas and Christmas Day, whatever, maybe industry knows that they need to influence them earlier, if that makes sense. So what have local authorities been doing about this? Well, historically, not many local authorities, only a third had an advertising policy. And they didn't particularly cover food. Only 24% had anything around food, and that definition of food and how they defined healthy or less healthy varied. That was work done by Sarah and colleagues through the School of Public Health Research, actually. And also with the School of Public Health Research, when Transport for London introduced their, for want of a better word, junk food advertising ban in, I want to say, 2018, an evaluation was funded through the School of Public Health Research, which has since published the data and saw an average reduction of about 1,000 calories purchased in London compared to a control area in weekly household purchasing. So the studies then suggesting it saved 100,000 cases of obesity and saving the NHS a lot of money. Yeah. Okay, so what are local authorities now doing about this? So we've now seen probably potentially even now over 30 local authorities in England who've introduced new advertising policies, not necessarily all represented on that map, the map from Sustain. Various scope of commodities restricted. So I can still see that Amanda's here. So Sheffield's policy is by far the most comprehensive in what it covers. Edinburgh's policy, I think, is particularly interesting, and I'd like to talk to colleagues about this. Their policy, from what I've seen and what I followed, initially started out looking at food because of fears around child obesity, but it took a number of years, as some of these policies do take, to get adopted. And by the time it was adopted, food as a universal restriction had been removed, and it really focused on the climate agenda. And I think, I don't know this for certain, that might be to do with kind of political change in Edinburgh City Council during that period. You've also got places where they are just looking at food. So Transport for London and the commitment from the Metro mayors, the mayors in combined authorities, that is food only. So yeah, Metro mayors talking about advertising food on, restricting food on their property, which tends to be buses and trains. It's a complicated web of who commissions all these different outdoor assets, of outdoor advertising assets. There's also an important interplay between policies and contracting. So during my pre-doc, I found that bus shelter contracts, so this is contracts to install and maintain bus shelters and also then manage the advertising within them, are lengthy. And there's reasons which I could talk about if people are interested why that's the case. So there's a mean of 13.4 years, but if those local authorities enact the optional extensions, it's 15 years basically. Some of them that I found were 30 years in length. So Bristol City Council had a really good timeline in terms of this. So they adopted their advertising policy in June 2021 and their bus shelter contract renewed in February 2022. It's difficult to renegotiate contracts in kind of middle of them. If I think about where I've done the pre-doc work and where I live, North Tyneside colleagues are looking at policy adoption, but their bus shelter contract doesn't renew until 2033. So they might, at least in terms of that advertising medium, be waiting a while to actually see a difference in that space. That's not to say that this work isn't important. There are still other advertising elements, assets outdoor that councils have, as I showed earlier. So my doctoral fellowship is looking at the implementation journey and impact of new advertising policies in England. Just in terms of the objectives, I'm looking at the barriers and enablers, and then the impact of a new advertising policy implemented in Swindon, and then also to see whether when the TV and online advertising restrictions coming on the 5th of January next year, do we then see a shift of any of that marketing spend into out of home sector? So what we've done is we've got three areas which we're looking at, Swindon, and then we're looking at Swindon as intervention area, looking at Middlesbrough and North Tyneside as controls. All three of those areas, the bus shelters are owned and operated by and maintained, sorry, including the advertising by Bauer Media Group. That company bought out another company called Clear Channel Europe North during the early part of this year. So it used to be that Clear Channel ran most of these contracts around bus shelters. It's actually now Bauer. So Swindon's advertising policy came in 2024, June 2024, sorry. My PhD started in October 2024, and their bus shelter contract in Swindon was due to change on the 1st of January 2025. So you can see that basically my PhD started, I had to get out straight away and collect data. So myself and a colleague in Swindon, James, who I was able to fund, got out on our bikes and did lots of cycling around bus shelters and took lots of photos. And you can see here the baseline data. Most of the advertising is for food in those areas. We are going to be analysing this data to see if there's any differences between the three areas. And we have got the data from summer this year that's still being analysed and cleaned. In terms of the HFSS, again, most of it was for less healthy foods, but it did vary. So as I said, we've collected the data from follow-up 1 this summer when there shouldn't have been any HFSS advertising in Swindon. But we did find a number of breaches. So on the left, you can see the Big Arch Burger from McDonald's, which is a HFSS product that was captured in August as part of follow-up 1. It shouldn't have been there. And then just 2 weeks ago, I was in Swindon doing public involvement work with the group of young people that I work with there. And as I was cycling about the town, because I'm me and I noticed bus shelters, I also noticed this one. So it's not part of my formal data collection, but even now, months after the contract has been implemented, there are still contractual breaches in terms of the advertising elements happening. It's something which I didn't expect to find, and there's a piece of work for me to now do to go and ask local authorities with these policies and then contracts, what are the clauses in contracts and the potential penalties for these breaches. You need to remember that these advertising restrictions are part of a much bigger contract, which is the installation and maintenance of bus shelters. But as it says on the right-hand side, that quote from Michael and his colleagues from Bristol and across the School for Public Health Research again, they've interviewed 15 local authorities, and there is a lack of resources for enforcement of these restrictions. So we do need to work out as a collective in public health and across local government, how are we going to do this? How are we going to maintain and ensure that these companies are complying with our restrictions? Moving on to work package 2, I appreciate this is very busy. So this is about trying to see whether any of the advertising which is now restricted on TV. So from the 5th of January, there will be no HFSS, tongue twister. There'll be no HFSS food advertised on TV before 9 o'clock and paid for advertising at any point online. So we were thinking to see whether any of that then changes to out of home, and principally we're going to use the data from North Tyneside because we've got data from 2022 at the top circled in green, and then compare that to some data I would collect in 2026. Government is predicting that about 25% of the TV spend and online spend will transfer into out of home following the restrictions next year. And that quote on the left, which is from an out of home advertising provider, very clearly to me suggests that they are saying to companies that now can't advertise online, bring your business to us because we are not restricted as much as TV. But thinking about using that North Tyneside data, something's happened since Christmas last year. So we collected the baseline data from, well, pre-doc data in 22, collected baseline from our PhD data in winter last year, and then from Christmas onwards, Clear Channel and then Bauer, when they got taken over, started replacing the bus shelters with paper-based advertising with bus shelters with no advertising. So on the left there, that's two bus shelters, and on the right, they've been replaced with these new bus shelters with no advertising. You can see the numbers there on the bottom. So I started my pre-doc, we had 167 bus shelters with paper-based advertising. By the end of follow-up one data collection, that had reduced to 86 because they'd mostly been converted to these bus shelters with no advertising. The 7 now that have got digital advertising shells, I can say that since that time, at least another 10 have been converted to no advertising. So the numbers are decreasing, and I'm not quite sure why. I did wonder whether it was because there is an increasing percentage of revenue going into out-of-home digital advertising. So you can see from this graph, again from Outsmart, the trade body for outdoor advertising, that 66% of revenue in 2024 for out-of-home advertising went into digital. And this just further reinforces that point. You can see how classic, which is paper-based advertising, has decreased over time compared to digital. And it makes sense. So my plans are having to change. I think when I first saw these changes happening in North Tyneside, I was like, well, that's really quite impactful on my PhD. I'm not going to necessarily be able to use North Tyneside as a control area anymore, potentially not for work package 2 either. What we're now thinking is actually to consider North Tyneside as a second intervention, because you've seen there's reduced advertising space, quite substantially reduced advertising space. So what does that do to what is advertised? I don't doubt that McDonald's are going to still want to advertise, for example. So do they just take up a greater percentage of the overall advertising space? In terms of work package 2, as I said, that shift from TV and online, we have still got data. We are looking to see how we use that data to get those changes, potential changes. Work package 3 and 4 will be 2026, so that'll be qualitative work with local authority officers to work out the barriers, the enablers to policy adoption, advertising policy adoption, and then also a survey with directors of public health about local advertising work and what more they would like to do. Data. By the end of this work, by the end of my PhD, I will probably have something near on 14,000 photos of bus shelter advertising. And that includes where they're located, GPS coordinates, a photo of every single one, and also the dates when they were advertised. If anyone on this call is interested in doing something else with that data beyond what I can do, so for instance, the one thing which I can't do is look at it in terms of kind of the persuasiveness tactics that's used in the advertising, please reach out, and I am open to sharing that data with people. A colleague at Oxford, Hannah Ford, is already looking at my data and data from elsewhere in terms of the carbon implications of the food advertising. So moving away from the food, but looking at the sustainability elements of what is advertised out of home. There is work going on elsewhere. So Frank DeVoit and his team in Bristol are looking at the Bristol advertising policy. Their papers have now been published, at least in preprint. So if anybody's interested, there's the papers. And then there's also, I've already mentioned it, School of Public Health Research work looking at advertising policies. This is a really, really useful paper. Thank you, Susan and SPHR for funding it. They've found that interviewing 15 local authorities, officers in 15 local authorities, there is likely minimal advertising revenue loss. That is the number one fear that I've heard of from local government staff, when you talk to them about advertising restrictions and bringing the policy in, they're afraid they're going to lose income. And I get it, local authorities are up against it financially, so it makes sense that they would be fearful of that. But the evidence to date from TfL before, and also these 15 local authorities outside, mostly outside of London, is that is not the case. Right, moving on to public health messaging, which is the other part of the talk that Marco wanted me to briefly talk about. I'm not going to claim to be an expert in this space. This is just some reflections from the bits and bobs of my 23-year career. If you want to talk to experts or read expert advice, there's a fantastic book there on the right. I'll talk to Marco because this is his topic. I was going to start out by saying, don't recreate the wheel unless you have to. By that, I mean, Public Health England previously and now OHID have got a fantastic campaign resource. So there's all types of different resources around campaigns that you can implement. Examples like Stoptober and things like that. I've said there unless you really need to. So there are times when things need to be adapted to be culturally sensitive, etc., etc. So sometimes you do need to reinvent the wheel, or at least try and learn from other people in your space. I've got the 4 Ps there. I know they're old and there are now more Ps, but I still like them because they make sense to me. Think about your audience. For example, could you go via workplaces? In the Northeast, we have a workplace health award scheme, which engages with about 450 employees at any one point and usually covers about 20% of the working population. I really like to use, when I used to do this work, I used to like paid for Facebook marketing because you can be really specific about who you want to target, age range, gender, location, etc. My only concern with particularly those 2 aspects I've just talked about there, could you be increasing inequalities in the work which you're doing? If you're focusing in workplaces, have a think about, are there workplaces that predominantly employ more affluent people? Or can you go to places where there are likely to be people of with lower incomes that you could target with your work? Talking to the academics in the room, I just want to kind of put a point out there for you to work with us to try to, well, to help you to recruit to your studies. And I'm going to give 2 examples. So back in, I think about 2012, I partnered with the University of Southampton. They've got this amazing tool called Positive Online Weight Reduction. It was essentially a standalone tier 2 weight management program online. We did a community-based trial and we stepped back and we thought about how we were going to recruit to this study strategically, used a number of routes, including we used market segmentation tools to reach out to people who were likely interested in this topic and would be likely to use a web-based tool. And we recruited sufficient numbers to do an RCT of that. This is probably my favorite example. So this was on the right was the Live Well study, and this was about supporting people to change their behaviors over the kind of peri-retirement period. I was involved in some of the design workshops for the intervention, and I said a number of times, well, if you are trying to target this group, you really need to engage with employers. So then I was asked, well, how do you do that, Scott? And I came back to the fact that we have this fantastic regional workplace health award scheme, 450 employers. So I was able to connect the academic team very quickly with a whole raft of employers. And from that, we recruited sufficient employers, sufficient employees. The team came to me afterwards and said, Scott, we're so grateful for your support. Do you want to be on the paper? And I was like, well, I sent 3 emails for you. I sent it to my workplaces that I was supporting and to my peers across the region. That's all I did. It's easy for us in practice where we've got those links to do that type of thing. If you're starting afresh, that's probably going to take you 6 to 9 months to do that type of work. So use and work in collaboration with us to get those things done. quick plug, in the new year, by the Transport and Health Science Group, we've organised these webinars. I'll share the slides afterwards so you can see this. Details will come out in the new year, but this is just to save the date. There's some amazing talks there. So yeah, I'll share those afterwards. And acknowledgements, my supervisors, Ashley, Emma, Amelia, career mentors, Sarah and Greg, advisors, Mark, Shalina and Jay. There's my email address, and thank you very much.
Excellent. Thank you. Thank you, Scott. You were perfectly on time, I think. I would leave now. I think there are a couple of questions in the chat, and maybe we can invite the people who commented to pose the question directly. Amanda and Eleanor, if you're still here. Yeah.
Hi. Oops. Hello. Hi, Scott. Nice to see you.
Hello.
I was just wondering, it was just a one-off. I was just wondering when you talked about how you categorized you're looking at HFSS, alcohol, and non-alcohol when you were looking at some of the advertisements. Did you include no and low alcohol in the non-alcohol category or the alcohol category?
That's very easy to answer because I've not seen any of that yet.
Really?
So
No, I'm
no,
surprised.
not at all. So it's an interesting question where I would put it, but I'm yet to see it. I think top of my head. I mean, again, I'm thinking across 8,000, about 6,000, 8,000 images. Certainly in the paper-based advertising, I've not seen no low stuff. There was an interesting one this summer, which was for a carver from somewhere abroad, and at the bottom there was a line, and that advert, it says, was funded by the European Union. I was like, thank you,
Bizarre.
European Union, for advertising a bottle of Carver. And it was one advert in Middlesbrough and I think one in North Tyneside. So it wasn't like mass advertising, but
I'm
it
sure that's
was, yeah, advertised by the European Union funded by the European Union to advertise Carver in Middlesbrough.
I'm sure that's probably one of the DOC things, isn't it? Like they probably get funding to push the DOC. You know how Parmesan is.
Yes.
You can only call it certain things if it's from a certain area. I bet it's related to that, but also still a bit strange.
I'll find it for you afterwards. I'll send it through.
I'll let Eleanor ask the question below because it's also linked. It's sort of in the same sort of theme as the question I was asking around alcohol.
It is, yeah. But on that point about that carver, that does just give testament to how effective the lobbying by the alcohol industry is in the EU, because it really is amazing. Um, I suppose it sounds like you're analysing the adverts in a very detailed way, because I was just starting to think as you were answering Amanda there, is there a risk that you would look at adverts for a no and low brand and not realise and think it is an actual alcohol brand? The reason I'm not trying to cast aspersions here at all, but we've just been involved in some research with children and young people looking at alcohol sponsorship by no and low alcohol brands of sports. And the first thing they see is the alcohol brand. They don't see the zero and assume it's an advert for an alcohol brand. But anyway, that was not what I was going to ask. What I was going to ask was related to that, though, which is that when you're looking at like an advert for McDonald's, do you categorize all McDonald's adverts as high fat, salt, sugar? Or if McDonald's was advertising a salad, would that count as healthy food, or at least not unhealthy food? Just because of what the alcohol industry does around this sort of thing. So, for instance, alcohol sponsorship and advertising is not allowed in France, but they just advertise zero brands instead.
Slight cop out. Well, no, I was going to lead with a slight cop out. I think it's something we need to consider as we go forward because, as I said, we've not so much seen this. I was just actually thinking. I did see a digital advert for a pint of Heineken. So it was the whole billboard was basically, it was clearly a pint of, and the bubbles were actually going up, and it had Heineken, but it wasn't. I think I made an assumption because it didn't actually say, it wasn't advertising no alcohol, no or low. I think I've assumed it was like advertising a pint of proper Can I say that?
You
Um,
can.
yeah, alcoholic Heineken, let's say that way. In terms of when we've seen brand only advertising, what we've been doing to date is, and we haven't seen masses of brand only advertising. We've, and if people got a different way of doing this, then please come forward and tell us. If it's just a brand only advert, we try to work out or think or estimate what that brand's most popular product is or biggest
Yeah.
selling item is. So in terms of McDonald's, we tend to think and use fries because that's probably their most voluminous single product.
Yeah.
Um, and fries, McDonald's fries, believe it or not, are non-HFSS.
Oh,
Yeah, indeed. But we haven't seen masses of brand only advertising, and in most policies, brand only advertising is banned. And I think probably that's what Amanda's going to come in and say.
yeah. Thanks.
You're on mute, Amanda.
Yeah, you're muted.
Sorry. I was going to say, I know the ASA use a method where they look at if 50%, so we tackled this particularly around the alcohol side of things, because we have included we won't advertise alcohol basically in our policy, and we've included no and low. But to decide if something was a brand that is synonymous with HFSS or alcohol, etc., we decided we would look at it in terms of the same way the ASA do, which is they look at the percentage of the product range of that company. So if more than 50% of the products are in the category of alcohol or HFSS, then we would consider that a brand synonymous with HFSS or alcohol.
Yeah.
The only issue with that is that I know that McDonald's are starting to circumvent that by they've expanded their drinks range to include a lot more no and low sugar products, so it means that X percentage of their menu items are now non-HFSS. So it's not that they've actually changed anything to do with their food. They've just increased the number of products which are non-HFSS so that they can get around that. The thing that would solve it would be sales data, which McDonald's flatly refused to publish. So that's the way that we've tackled the brand synonymity. Is that a word? The brand synonymity issue, but it's going to become rapidly out of date, that method, I think.
You've also got the case that a lot of products at McDonald's that you would expect to be HFSS are not. So for this bit of my research, I have a whole world of volunteers asking to help me. So and I know that other colleagues have done it differently, but in terms of they've used the McCann Widdowson database. But when I'm out and I see a photo for, I always say Cadbury's Whisper for some reason. Maybe it's because my favorite chocolate, but Cadbury's Whisper, I can then go into a shop or I can go online to the Cadbury's website or Tesco or wherever, and I can get the nutrient values per 100 grams. This is where people laugh. If I see a McDonald's, a Burger King, KFC, Tortilla, many of those brands, you go on their website, their nutrient values are listed per item. And to work out the HFSS or not, you need it per 100 grams or 100 mils. So I've got lots of photos on my phone where I've gone into, say, McDonald's. So let's say I've seen, I've just seen, it was in the photos there, so the Big Arch Burger. I then have gone into a McDonald's, I've bought a Big Arch Burger, I have found a discreet corner of the restaurant, I have got my scales out, weighed the burger in its box, eaten the burger, and that's the bit that I have lots of people volunteering to help me with, and then weighed the box afterwards. And then obviously I can convert to 100 grams that way. So I have lots and lots of photos on my phone and on the server here at Newcastle of product in boxes. Yeah, but a lot of the chicken-based burgers are non-HFSS. Lots of KFC. I've got a wonderful photo of a KFC Christmas bucket last 2 years, no, 2022. And The fries, the Pepsi Max, the chicken, the gravy, everything is non-HFSS apart from the popcorn chicken. And then there's also, if anybody's got any kind of university or access to kind of machinery that can do a proper kind of analysis of macronutrients, so calories, saturated fat, etc. I'd love to do this because my initial investigations are that, for example, McDonald's chicken nuggets are not HFSS, and they're not HFS by a long stretch. Like their score is, I'm not I'm conscious this is being recorded, so I'm not trying to say the numbers, but they've got a very low score, NPM score. Burger King chicken nuggets, from what I've looked into, are HFSS and they've got a very high. But it's like, well, how are two products that you would think are essentially the same so different? So, I mean, that's going off obviously buying and weighing the products and then taking their per item values from websites. But I would love to actually do that scientifically to actually see, because imagine if it came back and it said, actually, no, the McDonald's ones are HFSS. There's just something, I don't want to say fishy, because that would, particularly if we think back to kind of
Fish or
been
filet.
well, no, I was thinking more of the horse meat scandal from many a year ago. But yeah, there's something. Yeah, Amanda.
There's two things that have been on my mind that I'm sure you've probably thought about, or maybe thought about and not got an answer to yet. But I think I know the changes to the MPPF have been announced, haven't they? Well, they've announced it previously. Nothing's been done about it, but I know there's been another announcement reasonably recently around looking at the NPPF methodology, which I imagine is going to make some of the things that we've classified as HFSS in the past or non-HFSS in the past are obsolete now. So I think that's going to be interesting as to how any NPPF formulation might have an impact on data that we've collected. So I say we, it's like we're the royal we, that you've collected up to now. And the other thing is this is from having implemented a policy in Sheffield, how we manage sort of gatekeeping that policy when companies are reformulating products that exactly what you've just talked about, something that might look like HFSS, but actually turns out it's not HFSS anymore, at least according to the current NPPF methodology. And an example of that was Mr. Kipling brought out a whole range of those cake bars, which anyone who would look at it would think, well, that's clearly HFSS, but actually isn't anymore. And I think I'm right in saying, but I might be wrong, that Doritos might now be non-HFSS. There was something sort of that ilk that was now non-HFSS anyway, which was like, wow, that's quite shocking.
You are correct in that Walkers, and top of my head, I think they make Doritos. So Walkers have made their entire product range non-HFSS, have reformulated. I think the current NPM, and I'm not a nutritionist, and I see that we've got people on the call who are, so they're far more better place than me to talk about this. But some of the chicken products, they come back as non-HFSS principally because they get lots of C scores in the NPM model. So they score highly on protein, for example. They have high protein content, and that's valued in the current NPM. So that's principally why they come back as non-HFSS. Susan, Ashley's asked here at Newcastle and they can't do it. Lucy, I've asked an external lab and the prices that I got back were eye-wateringly high. So if you know somewhere where they're more reasonable, please send them my way.
Thanks.
Okay, thank you. Are there other more questions? Other questions from the attendees? Okay, great paper, Scott. Did you notice if advertising for certain food was more heavily concentrated in certain areas or the locations you were studying? For example, near schools, like the tobacco industry used to do. This is Daniel O'Neill.
Thank you, Daniel. So they're not allowed to advertise HFSS foods within 100 meters of a school, and industry have voluntarily, because they're very nice like that way, Certainly, Clear Channel historically have extended that to 200 meters. Uh, we've we've looked at it briefly, and this is one of the things which I want to do more of. But if somebody else wants to do it as well, I'm happy to work with them because we have got the GPS coordinates. So working out the NPM is, sorry, not the NPM, working out the kind of distance from schools as long as you've got the shape files is quite easy. The pre-doc data I looked at in terms of location of schools, in fact, there was very little food advertising in general within 100 meters of school. It seemed that they just weren't having food advertised in that kind of buffer. We do believe from what we've read that actually, because there was a confusion about whether it was 100 meters of the school entrance or the school boundary, and we're fairly certain they use the school boundary. Deprivation, as I said, we need to look at that. We've looked at it in our paper in Teesside. I just think there's something at play in that most town centres, city centres, come out as deprived on the IMD, and of course that's where bus shelters are concentrated. So I think there's something wider at play here than just thinking about, well, they're just targeting deprived areas. But I don't have any evidence yet. I need to reanalyze that data and come back with a more formal answer. As I said, Amy's review looked at all the evidence from across the world in terms of out-of-home advertising. So it wasn't just bus shelters and stuff that's on local government. It was commercial properties as well. So I wonder whether there was something around, again, if we pull the data that we've got across all the studies that Hannah's looking at, for example, in Birmingham, sorry, in Oxford, could we really look at that in terms of and get a better answer, at least in terms of out of home advertising on local government assets and IMD that way, because that would be a huge study. But yeah, more work to be done in that space, Daniel. And if you want to help us, we're here.
Thanks. Okay. I have a question. Probably this opens up another can of worms. I would say it's about the industry tactics, adaptation tactics to laws and regulations. Particularly interested in seeing this from the gambling perspective, for an upcoming grant for public health research. So maybe we can have a discussion later on because I'm interested in seeing how outdoor advertising for gambling is done.
Well, I mean, and Amanda can say more about this. So just for clarity in terms of where I work, Middlesbrough, we're currently working through adopting an advertising policy. So we're not there just yet. We're making good, rapid progress actually. Once we've actually got into it, we're making rapid progress actually, for various reasons I won't discuss here. But as I said earlier, some of the policies have got gambling in, some of them don't. So Swindon, where I am, is just an advertising policy wholly around food. So it doesn't include gambling, it doesn't include alcohol at the moment, but it's got provisions to include alcohol. Just eyeballing the data that I've got from Swindon after their restrictions came in, there seems to be quite a lot of alcohol advertising. So whether that's replaced some of the HFSS, I don't know. I mean, I've got to run the numbers. That's just eyeballing the data. I want to be clear about that. But some of the policies that are being adopted allow exemptions for the lottery, and some of them don't. So I think it's Bristol's that allows the lottery to be advertised on their estate. And you got to think about it. There's a bit of I can't think of the word, but local authorities and local groups in their local authority area often benefit from the national lottery. I mean, we've had Heritage Lottery funding, Sport England funding, a lot of that comes from the lottery. So, yeah, but some areas are including the lottery in their gambling restrictions in their advertising policies, and some are not. Amanda, is the lottery allowed or not allowed in Sheffield in terms of advertising?
Embarrassingly, I actually can't remember it. I was just Googling just to check. So you've caught me out. I
Some
actually
other
honestly can't remember, and I'll get back to you in a minute or so. I'll put it in the chat. I don't.
some
I think we exempted lottery. And the reason, if we have exempted lottery, I know we've had a lot of chat around lottery in the past, particularly with Greg as well, and we've looked at lottery generally, not just the advertising policy, but from wider things that we do around sort of removing ourselves from certain situations. We've agreed that lottery is a bit of a pick your battles approach. In terms of harm, we consider lottery much further down the harm scale from a gambling point of view. I'm also not a gambling expert, so there might be people who disagree with me on that point of view. But from a public health in Sheffield point of view, we've looked at lotteries being further down that harm scale, and that there is a pick your battles in terms of you are certainly not going to win any friends through tackling lottery, from everything you've just said around the amount of funding that's received by certain organisations, voluntary organisations that we quite happily work with from the lottery point of view. So when you balance the two, the harm versus the money that's come to certain partners, it's pick your battles. So, and I'll get back to you on whether it's included in our policy. I'm quite embarrassed about that.
It's okay. There's an interesting challenge as well in places where, and I'm going to pick on Tyneside because, well, for a start, I know that none of them have got an advertising policy just yet. Looking at them, but you've got places where they want to introduce advertising restrictions around high carbon industries, and Amanda, picking back on Amanda because it's Sheffield, but I mean, like that includes cruises and things like that, and holidays and flights and whatever. But then in some of those local authority areas, those councils actually have ownership of the local airport. So Newcastle Airport is actually part owned. I think it's 51% that the local authorities nearby actually own of the airport. So there's
The
a
conflict of interest.
yeah, that's the word I'm looking for, Marco. Thank you. Yeah, it's a fun space to be in.
Yeah, fun space. I think it's plenty of more questions and research we can do about it. So I think, thank you again. Amanda, do you want to come in?
I was just going to mention, I've just double checked our wording. We haven't actually specified lottery in our policy. We've just said gambling and betting products, services and organisations, and that includes in-game currencies used for gambling-like activity. So we haven't actually specified whether lottery is included or not. And to be honest, I don't think, I mean, it's certainly not come to me, but I'm not the first gatekeeper of the policy. We have an advertising and sponsorships policy officer who makes the decisions unless they're unclear. They've never brought anything to us from a lottery perspective. So my guess is that it's never actually come up as an issue. Like, we've never had any requests from a lottery point of view at the moment. But I also need to massively caveat that our policy doesn't yet apply to our outdoor advertising because of all the contract issues that Scott mentioned earlier. So we can't actually apply our policy yet because we're mid-contract with our outdoor advertising contracts. So.
I think this is something I found in my pre-doc that contracting is confusing because of the tiers of local authority, local government that we have. So I was reading today, Cambridgeshire are looking at advertising policy, and in this news piece it talks about how they had a workshop, and it was all actually in the workshop with these local government officers. It was all confused where the responsibilities and who actually own these different contracts. And I found that during my pre-doc, particularly with Cambridgeshire. So I did an FOI to Cambridge, as I did every local authority, about their advertising policies and contracts and whatever. And Cambridgeshire came back and said, we do not own this contract. It's the district councils. So I FOI the district councils, and district council says, we don't own this contract. It's the county council.
So they're back and forth.
Yeah, absolutely. So what I worked out, the way that I worked out to kind of get to an answer is twofold. So I can go on Google Street View and find a bus shelter in that place, and you can zoom into it, and you tend to be able to see a logo about who the provider is, and historical. Most of them are Clear Channel, now Bauer, or JC Deco. So, and then you can go on to either the council's contracts register or invoices paid. So every invoice paid over £250 in local government gets published on the register. So you can then say in this instance, I was unable to identify it was Cambridgeshire's contract. So I was able to go back to that person from their FRI team and say, yeah, you've said it isn't your contract, but actually it is, and here's the evidence. Please answer my questions. So there are places where it's certainly confused. And that doesn't help with the advertising policy work.
I see. Well, I think thank you so much. I think, yeah, we reached the end of this webinar today. If nobody else wants to say anything or to add questions, comments, I see a lot of thank you notes on the chat. I see Leslie also shows up in the camera. Hi, Leslie. Thank you for coming. And I thank everybody else who already left. And thank you for those who are watching or listening to this recording. And I'll see you very soon, probably, hopefully, in the new year. We have a new season in preparation now. We have a couple of more events to be announced after Christmas, after the holidays when we come back. So thank you very much again for attending. Thank you, Scott, again for giving us this season finale. Thank you so much.
Thank you, everyone. Have a great Christmas.